Hey guys, Kevin here from Crown Craft. I'm a licensed pharmacist, and today I want to talk a little bit about finasteride. It's one of the most studied drugs for androgenic alopecia or male pattern hair loss, but I think a lot of guys either make the mistake of never starting this treatment in the first place because they have anxieties, concerns, or fears about side effects, or they quit way too early before it has had a chance to work. And I think both of these misunderstandings come from the same place. They don't really understand either how the drug works or how it works in the body or what to expect when they start treatment. So the purpose of today's video, by the end of it, you're going to understand finasteride better than most people do. You're going to know the mechanism, the timeline to expect, what the evidence actually shows, and a little bit about the risk of finasteride and how do you make sense of all of this information. So that sounds good to you, stay tuned. But we'll start first with how does hair loss actually work? Like what's actually happening in your scalp for this to occur? So let's begin with how does hair loss even happen in the first place? I think this is very important to understand if you're going to understand how the treatments for androgenic alopecia works. And it's not a super complicated thing, and it's not a random thing either. We understand the basic mechanisms quite well as a whole. And to begin with, your hair follicles will cycle through 4 different phases. So the first phase is called the anagen phase, then a catagen phase, telogen, and then exogen. Your anagen phase is the growth phase, and this lasts the longest of any of the phases. And this is actually where your hair is growing. And that actually determines how long your hair can get. And then after it moves from this growth phase, it will move on to catagen phase, where there's like a brief transitional phase where the hair follicle is getting prepared to go dormant and shut down. Then it moves to telogen, which is a resting phase, and the hair is still on your head here, but it's no longer growing. And then finally, it goes to exogen phase, which is the shedding phase, where the hair is released, and then normally it starts a new anagen growth cycle. Now, in androgenic alopecia, the anagen phase gets shorter and shorter over time. So your hair follicle spends less time growing and more time in these sort of resting phases. And then each time it cycles through these phases, that growth phase gets shorter and shorter. So what happens here is your hair will eventually get weaker and weaker, thinner and thinner, and doesn't grow as long. And this entire process where the anagen phase gets shorter is called follicular miniaturization. So that is essentially how hair loss progressively gets worse and worse over time. All right, so you might be wondering, how does follicular miniaturization even happen in the first place? What's responsible? Well, as far as we understand it, one of the main culprits is a hormone called DHT, or dihydrotestosterone. This is a hormone that is made naturally inside your body from testosterone. And how DHT causes hair loss is it moves into the hair follicle and binds to an androgen receptor that is located on a very important group of cells at the base of the hair follicle, known as dermal papilla cells. When it binds to the androgen receptor there, it suppresses growth signaling and also actually promotes other signaling that further decreases growth. So it's like a 2-phase sort of system that's happening. And over time, when you're telling these cells to suppress growth signaling, your hair anagen phase shortens. So your hair hair follicle does not grow as long, and it grows thinner and shorter. And the more DHT stimulates that androgen receptor, the worse and worse this gets, until over time your hair becomes very thin, very short, until it's practically invisible. Now, you should understand that DHT doesn't kill the hair follicle. It merely miniaturizes it. So it makes it smaller and less prone to growth. This is an important distinction because the hair follicle is not dead. It's only miniaturized, and you can actually reverse this process and bring it back. When a hair follicle dies or scars over, becomes fibrotic is another term for it, there's not really much you can do to bring it back. So that's a very clear distinction between these two things that are happening. Your hair follicles are being miniaturized typically instead of being outright killed. So there is actually a process to revitalize it. Okay, maybe that was a lot to take in. Here's a simple analogy. Your dermal papilla cells, you can think of that as the command center for hair growth. DHT is a messenger. DHT goes to the dermal papilla cells and it's telling it, stop growing. So it listens, it stops growing. And over time, that hair follicle shrinks. The hair does not grow as long and it gets smaller and smaller over time. But the messenger is not killing necessarily the command center. It's just telling it what to do. And that's kind of a simple analogy for how DHT affects your hair follicles and how male pattern hair loss occurs. It's also important to recognize that not all hair follicles have the same signaling mechanisms around it, meaning they're not all the same. You might notice, and it's pretty obvious, that other types of hair on your body and on your head are not as susceptible to hair loss. Like, for example, the hair on the sides of your head, in the back of the head, other body hair, that doesn't really go away typically for most people. It's mostly hair on the top of your head or at the front of your front of your hairline. That's usually the first to go. And it's because different hair follicles have different susceptibility to DHT. There's different amounts of androgen receptors on different types of hair. And then there's also like a huge genetic component, right? Some people like make more DHT. Some people's hair is more susceptible to DHT. So there's like a lot of different things at play. So it's not just DHT and DHT alone. There's like a complex interplay of multiple things happening. And, you know, all that together coalesces and comes together to produce one end result. All right, so that brings us to our next point. If DHT is the problem, how does finasteride help with reversing hair loss? You probably know that this is a very popular and common drug that is used for this purpose, but how does it actually do what it does? And this, I think, is a very important thing to understand if you're going to eventually make a decision about whether you want to start it or you just want to understand better the treatment that you're currently on. Finasteride is what we call a 5-alpha reductase inhibitor. Essentially, finasteride does not remove DHT from your body. It actually reduces how much DHT your body naturally makes. Remember me saying earlier, DHT is a natural hormone that your body naturally makes from testosterone. So how it does that is testosterone is converted into DHT with an enzyme called 5-alpha reductase. You can think of it as testosterone is the raw ingredient, DHT is the final product, and 5-alpha reductase is like a factory that converts the raw material into the finished product. Finasteride actually comes in and sort of jams up the factory so that it ceases to function. In essence, that's how it works. You should know that there are actually 3 different types of 5-alpha reductase enzymes inside your body, or 3 different isoenzymes. And you can take a look at this little chart that I put up here. Type 1 is mostly found in your sebaceous glands, also in the skin, the liver, a few other places. Type 2 is the one that's most relevant to our discussion. This is primarily found in the actual hair follicles and in the surrounding area of the hair follicles, and also in the prostate. Type 3 is a little bit less relevant. It's widely expressed throughout the body, but it doesn't play too much of a role in hair loss or androgenic alopecia specifically. Finasteride primarily inhibits type 2 isoenzyme, which is why it's so effective for hair loss. It doesn't really affect type 1 and type 3 to any meaningful degree. However, there is still a bit of DHT that is made from type 1 and type 3. A 1 milligram a day dose, finasteride basically reduces your blood DHT levels by about approximately 70% because it only targets the type 2 enzyme mainly. So there's still other enzymes in your body that's still making DHT. You're not really shutting down DHT in your body completely, you're just turning it down to a trickle. What happens when you reduce DHT? If you remember back to that analogy, DHT was like a messenger that's signaling your hair follicle to stop growing. So when there's less DHT making its way to the hair follicle, to those dermal papilla cells, your suppressive signals ease up. And over time, that hair follicle can basically come back to life. Its growth signals come back alive, your hair cycle begins to lengthen again, the miniaturized follicles start to produce thicker and longer hairs over time. But this is a process that occurs slowly over many months. It's not a simple on-off switch, and that is important to understand. Finasteride works best on hair follicles that are miniaturized, but not yet completely dead. That's an important caveat that you must understand. The longer you wait after hair loss has begun, the more likely that hair follicle has died. It's almost like a use it or lose it sort of situation. The earlier you address the problem, the more you have to work with. Maybe you can think of it as like the hair follicle is very, very weak and not healthy, but once you remove this signal that's telling it to shut down, it can actually come back to life and perk up. But once the hair follicle is completely dead, you can't really do much about it, right? It's like trying to water a plant that has totally died. There's nothing you can do. But maybe if you caught it earlier, it could make a comeback. So hopefully at this point, things are starting to make sense. Okay, DHT is what's responsible for my hair loss. Finasteride suppresses the reduction of DHT, and then my hair follicles will reverse its miniaturization and hair will begin to grow again in like a healthy, youthful way like you had before. But a next obvious question would be, how much suppression is enough? We know that 1 milligram a day of finasteride, your standard Propecia dose, which is the brand name, that works very well. But is more better? Is less still as effective? That's a very good question. So there's actually a really good, very pivotal dose ranging study that examined this. And they looked at finasteride doses, oral finasteride, at 0.01 milligram, 0.05 milligram, 0.2 milligram, 1 milligram, and 5 milligrams to see what doses were best for hair loss. And to sum up the study, essentially they found that about 0.2 milligrams was the threshold for effect, and most benefit plateaued at 1 milligram, and you didn't get that much more benefit at 5 milligrams. There was a bit more hair growth the higher dose you went, but there's a lot of diminishing returns, so to speak. This study also measured something very important, which most other studies do not report on, and that is scalp DHT. Why is scalp DHT so important for male pattern hair loss? Simply put, it is the most relevant and direct measurement of use to us when you're talking about a DHT lowering medication. Most people will talk about serum DHT or DHT in the blood, but DHT in the blood and DHT in your scalp are not that closely related as you might think. They're just proxy measurements for each other. So typically speaking, higher blood DHT levels will typically mean higher scalp DHT levels, but not always. A good analogy to think of is if you see someone with a Rolex, you can most likely assume with a fair degree of confidence that they have some money. But is that always true? No. I'm sure you know someone who's out there flexing a bunch of money, but they're actually broke as shit, right? They're often correlated, but not always. So that's why the actual measurement of DHT in the scalp is so important. So as you can see from this graph, they saw that around a 50% reduction DHT, that's when you start seeing clinically meaningful benefit. And the more DHT you suppress, the more benefit there is to a degree. I think for most people around 70%, that's plateauing. You can suppress more and you will actually have a little bit more benefit, but that additional benefit starts to drop off. It's definitely in diminishing returns category when you suppress further and further DHT. So you're probably already asking yourself, damn, I know someone who had great results on 0.5 milligrams every day, but I needed 1 milligram, or shit, even I might need 5 milligrams a day to see a benefit. Why is there such a huge variation if it seems like 0.2 milligrams is enough for most people? Well, you have to respect your own individual biology. That's not something you can easily predict. That's a variable that is hugely different between person to person. I mean, we've all known the person, for example, in my own life, I have a friend of mine in college, and he was famous for getting completely drunk off of 2 drinks, 2 beers, and he's close to blackout. And then we all know the person who can down 10 beers and seem fairly normal. So this all has to do with your own biology and your own response to the medication. And that's not something that can be ascribed to you based on a research study. The research study only shows what is the typical response in a population and what we can start with, and gives you a reference for what are reasonable doses to experiment with and what are reasonable ranges to consider. I mean, it wouldn't make sense for you to say, I take finasteride 1 milligram once a month, nor would it be reasonable to say, I'm going to take 100 milligrams every day looking for more benefit. So you kind of want to put these things into perspective, and this is where the studies are useful, but they're not the end all be all of dosing. It's also really helpful to understand the pharmacokinetics of finasteride, and that basically means how long does the drug last in the body, how does your body interact with the medication, to put it simply. And the reason why you should understand pharmacokinetics is this will help you understand what are the expected timelines for side effects to occur, for the drug to leave the body, when should I start seeing results. Some basic parameters about finasteride is the half-life is about 6 to 8 hours. However, the duration of effect is much longer. And the reason for that is when the drug binds to the enzyme is irreversibly inhibited. It means that once that binds, it doesn't unbind and the enzyme works again. That's a one-way street. So once that happens, the enzyme can no longer function, and for your body to restore enzyme function, you have to make a new enzyme. So this is why, even though the drug only lasts 6 to 8 hours in the body, once a day dosing is very effective. And your steady state for your levels of finasteride in the blood, usually you'll get there within a couple of days, 3 to 4 days, and you'll have maximum suppression of your DHT in about a week or so. Obviously, these numbers can vary depending on your own personal biology, but this is like a good reference to work off of. Now, typically, when you stop taking finasteride for whatever reason, your serum DHT levels will slowly return to baseline over anywhere 2 to 3 weeks, typically speaking, for your average patient. This can vary a good deal, but that's like a good reference to think about. This happens because when the enzyme is irreversibly inhibited, that enzyme and drug complex has to be metabolized by the body first, and new enzyme has to be synthesized. This is why, even though the half-life is very short for finasteride, and the drug is cleared rapidly by the body, the bound complex takes a lot longer to clear, and it takes time for your body to make new enzyme. So this is why the effect of the drug, again, is not that closely tied to the half-life. It kind of is, but there's a big difference here, and that's important to understand. This is also why when you start taking finasteride, even though it takes about, let's say, a week to reach full effectiveness, it takes a lot longer for changes in the hair to occur. This is a biological and biochemical process that affects change slowly over many months. So after all of this yapping, you're probably asking, Kevin, let's get on with it. What about the actual human data? I mean, let's be honest, right? That's why we're actually here. Does this shit actually work in a real world scenario? And how well does it work? Simply put, the answer is yes. It works very well for the vast majority of people. We can look at the pivotal trial back in the late 90s that got this drug approved for male pattern hair loss in the first place by Kaufman. And this was a multi-center, randomized, double-blind, placebo-controlled trial, very great quality. It ran for a total of 24 months. There was an initial 12-month study period, and then they extended that for another 12 months. This studied about 1,553 men, ages 18 to 41, with Norwood 2 to Norwood 5 hair loss. And they looked at hair loss using photography in a very specific target area, and they performed very tedious hair counts. This is a super objective and very high quality way to measure a human response. So looking at this chart here that I've made from the study, it's pretty easy to follow. Over time, as the study group took 1 milligram of finasteride a day, the hair counts in the target area deviated from the placebo group. So over time, the placebo group slowly lost hair month to month. The initial cohort was followed up to the 12-month period, and there's a difference between them of approximately 107 hairs in that specific spot on the scalp that they were tracking. And then that difference actually widened at the 2-year follow-up for people who continued on to the extension part of the study. And they didn't really gain any additional hairs for most people in the study group, but they kept the hair that they had, whereas the placebo group continued to lose hair. This is a really interesting graph directly from the study that actually shows you that they tried to cross over people at the extension point at the 12-month mark to see if the drug itself was effective and what would happen if you switched one person from one group to the other. So you see in the finasteride to placebo group, and these are men that at the 1-year mark switched over without their knowledge to placebo, pretty brutal. They lost hair that they had regained. Not quite as much as the people who never took the medication itself, but they lost significant ground over the next 12 months. And you can also see the placebo group that then switched over to finasteride. They started to regrow hair in the next 12 months. Not quite as much as the people who were on the treatment dose the entire time, but you can see that this basically proves that finasteride is effective, but you still need to stay on the medication to see benefit. Briefly speaking about side effects, in this particular study, they saw about a 1 to 2% rate of side effects in the placebo group, and about a 2 to 4% approximately in the study group, which was taking, once again, 1 milligram per day of finasteride. Most of these side effects were related to libido issues or issues with erectile dysfunction. This data was later expanded upon when they studied men ages 41 to 60 to see if this same effect was seen with older men. And largely speaking, yes. A similar pattern showed up here, establishing that finasteride does work on men of a very broad age range. Long-term follow-ups are also available. Some of the best longitudinal data we have is this Japanese study, which looked at 532 Japanese men, average age around 38, but it was a pretty large age range. And they followed them over a 10-year period, and they took finasteride 1 milligram orally once a day. Doctors would basically take scalp photographs and grade them on a 7-point scale. And essentially this study showed that the vast majority of men, 90%, showed measurable improvement in their hair at the 10-year mark. And 99% either it had improvement or at the very least held steady. They did not lose any ground. Only about 1% of patients actually had progressive loss of hair during this time span. And there was also patients that continued to have improvement from years 1, 2, 3, 4, 5, 6, and onwards, showing that the response to the medication can be highly variable and very promising. On the right-hand side, you see successive photographs of the same patient taken over a 5-year period. And you can see that he's just, improving steadily over time, right? The most dramatic improvement is early on, but you can tell even from the last 2 sets of photographs that there is a bit more regrowth, even at the 5-year mark. So, in conclusion, finasteride is just effective and it stays effective. There's also a 2010 meta-analysis that looked at 12 randomized clinical trials studying men who were taking finasteride 1 milligram versus placebo for hair loss. They recruited in this entire meta-analysis as a total of roughly 4,000 men. And the results showed that if you took finasteride versus if you did not and you took placebo, you're 80% more likely to have perceived an improvement in your hair loss. That is actually a really, really good result. That translates to you're almost double your odds of perceiving a meaningful benefit, meaning your hair loss either slowed down and stopped, or you actually regrew hair. To put that into perspective, many other pharmaceutical drugs do not hit this sort of statistical measurement and they get approved. So relatively speaking, finasteride is very, very effective. To sum up a lot of the studies out there with finasteride for hair loss, most men see this sort of pattern, at least in the evidence that we have. In the first 1 to 2 years is where most of the benefits are seen. That means you either have regrowth or a slowing of further progression of hair loss. Some men take up to 1 full year before they have any visible improvement, so it takes a while. However, for most people, after 2 years, you're not getting that much more regrowth. You're typically just holding back the Norwood Reaper, right? You're keeping further loss from happening. There are some men that actually continue to see further and further benefits in years 3, 4, and 5, but that's typically not as common. Usually the people who are slower responders are further along in their hair loss, in the higher Norwood stages. They will see more gradual improvement, whereas the people who, were not as far along, they kind of regain a lot of lost ground quickly and then mainly hold it there. So once again, I want to stress, the sooner you get started on treatment, no matter what that treatment is, the better chance you have of the treatment being effective, and you'll get much more effective results. So we just went over a lot of evidence, a lot of mechanisms. We know finasteride works, but knowing what to expect and when to expect it is two very different things. Let's talk about timelines, because this is another piece that a lot of people get wrong, and I see a lot of anxiety and panic about certain things happening early on in the process. So, let's dive into it. So the first thing to understand is that a hair growth cycle takes time, and it's a slow process of growth. Your anagen phase, the growth phase, lasts 2 to 6 years. And finasteride doesn't really make your hair grow any faster. That's also, I think, a bit of a misconception that some people may have. It really changes the hormonal environment in the hair follicle and inside your body so that the next growth cycle is better. A good analogy would be like if you came across a garden that has been neglected for a long time, right? No one's really paid attention to the soil. There's no more nutrients in there. It hasn't been watered in a long time, but you know that there are some dormant seeds, but right now nothing is growing. If you start to tend to the soil, water the ground, add some fertilizer and stuff like that, you can't expect plants to show up in a week or two. This is the same thing with your hair. These things take time, and the next growth cycle is actually when growth will occur. So your hair follicle has to transition through all of those different stages that we talked about in the beginning, get to exogen, shed, and then return to anagen, and that's when the benefits are seen. So what are some realistic expectations then for results? Let's look at it month by month. So in month 1, you're started the medication and your DHT levels are dropping down. By the end of the month, they'll be at the new low baseline. You'll have reached steady state of the drug. You really should see basically 0 visual changes. There may be some shedding that happens to some people. That occurs because hair follicles that were close to exogen are transitioning over to a new anagen phase. This is reported often, like anecdotally, from people who take finasteride. It doesn't happen to everyone. Most of the trial evidence doesn't really talk about this very much, but that is to be expected in some people. Now we move on to months 2 and 3. Still, for the vast majority of people, you're not really going to see very much visual change. There might be some early activity where loss may be slowing down, but you probably can't tell. In the earlier trials, they did measure hair counts at around month 3, and in some patients, they saw a little bit of regrowth. But I mean, can you really tell if an additional 5 hairs are growing on your head? No, that's not a visual difference you can perceive. So this is a bit of the frustrating part of the process, where you're kind of watching, waiting, and you just have to be patient. All good things come with time. There could be some additional shedding that people experience at this phase. If you see that, do not be alarmed. That's pretty much normal and to be expected. Once again, hairs are moving from exogen phase back to anagen, and there's actually a hair cycle synchronization that's happening. So a lot of hairs are, instead of being in different stages of the hair growth cycle, a lot of them are moving to anagen phase, because now that suppressive signal from DHT has been gone for a while. So you may or may not see increased shedding at months 2 to 3, but there's really no reason to expect any visual change. Once again, most of the guidelines and the research is very clear on this. Now moving on, this is the first real checkpoint, the 4 to 6 month mark. This is where the first signs of clinically perceived benefit or noticeable benefit will be seen for majority of people. This is where you can assess whether hair loss has slowed or some regrowth has happened. So really any meaningful measurement before this time point is not a reliable indicator of whether things are happening or not. I know that sounds like a long time and it can be frustrating. That's unfortunately just the reality of this process that takes time to reverse. In fact, some people do not even see results yet at the 6-month mark. They have seen that in other trials, where it has taken a full year for perceived benefit to be visible. But they did respond at the end for those cohort of patients. And these are typically people who are a bit older or are further along in their hair loss, right? You can imagine it as a hair follicle which has been dormant for a longer period of time will need a longer recovery period to revitalize and rejuvenate. Now the next milestone will be your 12-month mark, or 1 year from the start of therapy. Whatever you have gained or not gained at 12 months is very strongly predictive of how you'll respond moving forward. Some men take about this long to see any sort of benefit. If you have results at the 1-year mark, you're very likely to have long-term benefit from whatever regimen you're currently on. This has had enough time for the medication to do its job, for any miniaturized dormant hair follicles to rejuvenate and revitalize and start growing hair again, and for you to see that growth. If you haven't seen results at this time, there should be a serious discussion with you and your healthcare provider as to whether or not other methods should be trialed, or if whatever you're doing maybe is not working out well for you and you should explore other options. Now, moving forward even further along to the 2-year mark, this is kind of where any regrowth or a halting of growth usually plateaus. So your benefit kind of tops out here for the vast majority of people. And from here on out, the pattern changes to, instead of regaining lost ground, is sort of keeping wherever you're at. So you're kind of topped out, you're probably maximally effective here, and you're basically going to continue at this point for many years to come. There are certain individuals that will continue to have benefit at years 3, 4, and 5. And once again, these are people, generally speaking, who are a little bit further along in their hair loss. And they will continue to gain ground in these later years. But for the most part, this is like your maintenance phase that you're getting into for the majority of men. In summary, the key takeaway is this. This is a biological process that takes a long time to have perceptible results. So you have to stick with it in order to make an accurate judgment call about whether or not it's working for you. It takes up to a year to see any sort of benefit, and maximal benefit may take up to 2 years. Obviously, everyone's biology is a little bit different. Some people may be hyper responders and see dramatic results much earlier. Other people may take more time. But you have to understand the typical timeline in order to make a decision whether or not you should make changes now, or whether this is normal and you should commit to the process. I know it's a bit frustrating and can be anxiety driven. Seeing a shedding happening earlier and you've already lost a lot of hair and now you're losing more hair. But this is to some degree pretty normal and to be expected. So don't panic. I don't want to see another post on the forums about someone abandoning the therapy because 2 months in they, noticed a bit more thinning. Like, come on guys, please be informed about what's going on here before you make a rash decision. Okay, so we've talked about the mechanism. We've explored the evidence. You understand the timeline now. Now, the most important thing after all this is, how should you take finasteride? Right, $10,000 question, $1 million question, really. You have some options in front of you. Essentially, there's 2. There's oral and all the different regimens in between, and topical, which also has a variety of different options available to you there. Let's talk about both of them. So to start with, let's talk about oral finasteride, your most commonly available cookie cutter option. Propecia, finasteride 1 milligram once a day. This is the most studied dosage. It's the FDA approved dosage. It works well. At steady state, it suppresses about 70% of your serum DHT compared to baseline. They do actually have studies looking at smaller doses, and I talked about it earlier a little bit, but the 0.2 milligram dose seems to be approximately equivalent to 1 milligram as far as reducing your serum DHT level, and 0.5 was a very, very close to 1 milligram. So that's a commonly used dose for other people who are using this a bit off-label, or running your own experiments a little bit. So 0.5 milligrams a day. Typically, I would say most people have the best benefit at 0.5, but there will be some people who respond better at at 1 milligram, and some people who have also a very good response at 0.2. It's a bit genetically determined, right? So you can't really predict how you will do on the medication, but this is a reasonable reference range to target for your dosing. And you may ask, like, how much DHT needs to be suppressed in order to have an effect, right? Like, how much can I get away with? And they've done some studies about this, and there's one here that I'll reference this chart again, which implies that maybe a 50% reduction is like the minimum effective dose, or minimum effective reduction, I should say, for effective treatment of male pattern hair loss. So another great option is topical finasteride. This has become much more available in the recent years and is a great emerging option. You can get this like on a lot of online compounding pharmacies, usually comboed together with minoxidil, which is a great combination for treating hair loss. But we'll talk about minoxidil on another video at another time. Most people like the topical finasteride because maybe they don't like taking pills, or that they feel that maybe the topical can have a lower risk of side effects. And there is some data to support that. However, there is a risk of topical finasteride going systemic, meaning to the rest of your body, and having an effect that you don't want, that you're trying to avoid by using it topically. And the FDA did flag this safety warning in 2025. I'll show that here. So because it's a compounded product, every pharmacy is a little bit different as far as what sort of vehicles that they use to compound the active pharmaceutical product with, and what other additives that they use in the product. And honestly, like, how good of a compounding pharmacy are they, right? There's a lot of variation in compounds. And I know this myself, like having done compounding before, like one person making a certain compound will not be the same as somebody else doing it. It's like different bakers making the same cake from the same recipe. Maybe one person's cake will come out one way and the other person's will be different. So that's the risk that you're taking when you're using a topical compounded product. There could be some variation, and that could change how it works in your body. So the research for topical finasteride is actually pretty promising. There's this large phase 2 trial that looked at topical finasteride at a 0.25% concentration compared to 1 milligram a day of oral finasteride. So if you look at this chart that I made from this trial, it sums up the most important takeaways. You have 458 men that were enrolled in the trial. They looked at a dose of topical finasteride, which was a 0.25% solution, and they administered 0.2 mLs at most once per day. That's a very small amount, so you're not just glugging a ton on. That's important to remember. Anyways, looking at the hair count increase, this is the main endpoint. It was basically the same as oral finasteride. And side effects, reported side effects that is, was less in the topical group, and it was actually very similar between topical and placebo. Oral finasteride patients did report more side effects. This possibly could be explained because your systemic DHT was less suppressed on the topical. You can see that in the middle portion of this chart, about 38% less suppression. And They also looked at serum levels of finasteride in the blood, and with proper topical application, it's about 100 times lower compared to oral. What's the key takeaway here? So in essence, topical finasteride used appropriately can be just as effective for treating hair loss as oral, depending on the person, right? Of course, there's a lot of genetic variability. And typically, you are less likely to have side effects from the topical finasteride compared to the oral option, which kind of makes sense if you look, refer to the data mechanistically, right? You're just getting less drug exposure. But there's a lot of caveats because this drug was administered in a very specific manner and in a very specific amount, a very small amount. So at the end of the day, which option do you pick, right? So you have oral on one hand, which is the most well-studied, most likely the most efficacious, but may have a higher risk of side effects. And then topical is the opposite. May be just as effective, it might not be. There's less data around it, but it could be more tolerable and you may have less risk of side effects. But there's also this variation in formulation between different pharmacies and different brands. So how do you pick? Well, I think that your own individual preferences and your own individual response to the medication is the deciding factor. And you can't actually know that without trying something. I have a video on this that I'll link to here. At the end of the day, there's really no right or wrong option. There are different tools with different reasons for picking one or the other. So it's a personal decision that you have to make. Hopefully you have a doctor or another trusted healthcare professional or some kind of person who's well-versed in hair loss who can help you make that decision if you're unsure still. Okay, now let's talk about it. The topic everyone's been waiting for. What about the side effects of finasteride? No finasteride video is complete without touching upon this. It's such a controversial topic. It's almost like abortion or gun control. So what's the truth? Is finasteride actually a super dangerous medication that once you take one pill, you're going to ruin your life forever and you'll never recover? Or is it actually fake news? None of these side effects are real. It's all in your head. I personally think that there is actually a little bit of truth to both sides of the argument. Now, this is a huge topic that is endlessly debated. We're not going to be able to cover everything. In fact, you can probably do an entire video just on this by itself. There's researchers that have devoted their entire academic careers to studying this and post-finasteride syndrome, as it's commonly known as. So we'll just kind of touch upon the high-level view, and I'll maybe break down the nitty-gritty science of it a little bit later. So what sort of side effects do people report in these sort of trials for finasteride? What are the most common? That would be typically sexual side effects, such as decreased libido, erectile dysfunction, changes to ejaculation, those sort of things. And just to put it plainly, in people taking finasteride, you see roughly a 2 to 4% increase in rates of side effects compared to placebo. And in the placebo population, about anywhere from 1 to 2, maybe 3% of people report side effects. So you have to understand, even in the placebo group, people do report side effects or perceived side effects. Your normal population just has these sort of issues, right? Not everyone is perfectly healthy. So finasteride may increase that risk by a few percentage points. That's the nitty-gritty and bottom line takeaway here. 2 to 4% increase. You'll see different studies and meta-analyses report slightly different numbers. This is due to the fact that no two studies looked at the same group of men. They are also slightly different, maybe in the amounts and regimens of medications that men were on. There's also a different definition of adverse side effects from one study group to another, and so on and so forth. Most of these side effects, for people who do experience them, will often go away when people continue taking the medication. And most patients do report that when they stop the drug, that the side effects eventually dissipate. Where the data gets a lot more interesting and honestly a bit more murky is for post-finasteride syndrome. So these are a smaller cohort of men who have reported being on finasteride, experiencing side effects, stopping the drug, and then having prolonged side effects after many, many months of stopping the medication, when typically their levels of DHT should have returned to normal. They still report symptoms. In addition to the sexual side effects that people experience while on the medication, in this cohort, you will see more reports of cognitive dysfunction, anxiety, depression, maybe even in more extreme cases like changes to like penile morphology. This is much more serious, and in some people they say, I have experienced these side effects for years after stopping the drug. There is a lot less definitive evidence studying this cohort of people. I think back in 2012 is when the syndrome or post-finasteride syndrome was first formally recognized, and there's a lot of different proposed mechanisms about how it occurs. Some people think it's due to dysregulation of neurosteroids, which are steroids that your body makes and has effects on the brain. There could also be changes in your gut microbiome, changes in how dopamine and serotonin work in the body. There could also be long-term DNA changes. These are all more preliminary research that is still being conducted. They're either in animal models or in a very, very small cohort of people. And there's intense debate about whether or not this is a real phenomenon, whether or not there's some sort of confounds that are at play that make the interpretation of this evidence like very difficult. So it is still an emerging and very interesting area of research. So what are you supposed to take away from all of this? Essentially, side effects are probably real from finasteride. I think the data does support that there is a small cohort of men that do experience this. And I would say, personally, my opinion, that an even smaller cohort may actually have long-lasting side effects that do not reverse in a rapid fashion after even discontinuing the medication for a long time. But the data on this is still being worked out. And it's very hard to predict whether or not this person will be susceptible to the side effects, or maybe this side effects was from a different reason unrelated to the medication. This is a really deep topic. We'll probably go into it in much greater detail in another video. But for you, you really should take these side effects seriously. Don't ignore them. But please understand that this, by the statistics, is actually a very small group of people who do experience this. So it's definitely not a guaranteed occurrence if you were to go on the medication. Ultimately, you might not like this answer, but it's your body and it's your decision. No one can tell you, please do this or don't do this. But now you have a bit more information to make an informed decision instead of just listening to internet panic or people hand waving and saying this is not real. Now you have the data to make your own call. All right, that was a lot of information. So let's kind of sum everything up in a few key takeaways. First of all, finasteride works by reducing DHT. This is the hormone that miniaturizes the hair follicles in your scalp. It doesn't actually remove DHT entirely from your body. It just kind of turns the volume down on it enough for your hair follicles to recover and regrow. The evidence for finasteride working is very robust and very strong. There's lots of well-controlled large clinical trials and also longitudinal data for up to a decade that shows that it does work and it continues to work for the majority of men. About 80% of men have some sort of improvement or stabilization of hair loss. It's one of the most well-studied treatments in dermatology for androgenic alopecia. However, patience is a non-negotiable when doing any sort of treatment for hair loss, except maybe a hair transplant. Real results, however, from finasteride specifically take anywhere from 6 months to a year or even longer to see visible changes, or to even decide and make a judgment, an accurate judgment call on whether or not it's working. If you quit at like a month 3 or 4, you didn't really give it enough chance for it to actually do anything. And you also have options when it comes to dosing, right? You can go with the gold standard oral finasteride, 1 milligram a day. You can play around with the oral dosing and see, maybe a lower dose may work just as well for you. And then there's also the topical option, which is emerging with new, very promising data for it being also just as effective with possibly less side effects. And finally, side effects are real, but they affect a minority of men. Most men who experience side effects, the side effects go away if they continue taking the medication, or they go away after they stop taking the medication. There's possibly a smaller cohort of men who are very unfortunate and have prolonged side effects after stopping the drug. But this is an area that is still actively being researched and we understand less about. You should take the side effects seriously and stay informed, but don't let that stop you from making a decision one way or the other. And stay tuned for my upcoming video just dedicated to this topic specifically. And in closing, if this video helped you understand finasteride just a little bit better, I would really appreciate a like and a subscribe. I'm trying to build this channel out to be a resource for everybody who is interested in this topic. And if you have any other further questions, just drop your comments below and I will read all those comments and respond when I can. Thank you for watching. Stay tuned for the next video. Kevin out.